Without further ado, it's really my pleasure to introduce Dr. Donna Norris. As I said yesterday, I'm not going to read people's full bios. It is on page 6 of your conference booklet, but I am going to highlight a few things about Dr. Norris. She's a practicing child, adolescent, adult, and forensic psychiatrist in Wellesley, Massachusetts, and the director of diversity, equity, inclusion at Beth Israel Medical Center, and the clinical assistant professor in the Department of Psychiatry at Harvard Medical School. And I think a couple of things that are notable about Donna is that she was the first woman and first African-American speaker of the Legislative Assembly of the American Psychiatric Association. And that's a pretty powerful thing for the APA many years ago, and still has its challenges with having people of color or Black people lead in that national organization. And Donna has been at the forefront at all things academic, but all things in organizational medicine, really putting Black people on the map and putting our voices as physicians too at the table and as psychiatrists. The other thing I wanted to say, in Boston years ago, she was one of the founding members of the Boston Black Psychiatry Group, which was, and as she will say, and maybe she'll say it more eloquently than me, but I know that from her and then other folks, that there wasn't a space to really think about case discussions about Black people in Boston during her training and beyond. And so they really wanted a place to come together as Black trainees, as Black early attending psychiatrists, to really think about how do we think about Black patients and the care of Black patients. So it's by no surprise then that we asked Donna to be the keynote speaker today to really speak to that and many of the things that she's done over the course of her career. And she'll probably mention it during her presentation, but most recently, her and Dr. Anil Prim edited a book called Mental Health, Racism, and Contemporary Challenges of Being Black in America. And so I encourage you all to read it, get it, about just the challenges, not only in America, but I'm sure that across the diaspora that Black people face. And then on a personal note, Donna has just been a great mentor and a sponsor of me in my career. And so it's really nice that I get this special privilege to introduce her today. So Dr. Norris, come on up. She'll be talking about climate change and its impact on the mental health of children of color.
Thank you very much, Dr. Michelle and David and Bungo. Thank you so much for inviting me. I'm really honored to be here today and to talk with you. It's not a lecture. It's really a discussion just about children and how they're faring in terms of climate change. And first of all, I'd like to say that a lot of things that we talked about yesterday, a lot of the topics, there's going to be an overlap in terms of what I'm going to talk about and what we learned yesterday. And I wanted to say a couple of words about Chet Pierce because he started this whole idea of meeting together, and as David talked about, having a special place to come and to talk with other colleagues in the world. He really was a global person as opposed to just being United States based. And although I would like to take credit for founding the Black Psychiatrists Forum of Greater Boston, I can't do that. And actually, when I was a resident, it had already been formed by Chet Pierce and Charles Penderhughes and Francis Bonner, and I benefited from being able to meet with them. And I was telling our media person yesterday, you know, when you're young and you're trying to remember all the people that you're listening to, you don't really appreciate them in the same way that you do some years later. And I must say, I appreciate Chet every day because he really has been an inspiration. You'll hear about him because I have him in my talk as well. But this is a wonderful opportunity. He'd be so proud of you that you've continued this and actually are just moving forward. So I'm very pleased. Now let me just see if I get this. I told David this morning if there's a glitch, I'll feel wonderful because everybody had a glitch. So this is a picture, a NASA picture from the satellite, and you look at the Earth, and it just looks magnificent. But when you get down closer, you see that there are real problems that we're experiencing based on climate change and all kinds of other difficulties that are going on in the world. And these all have an impact on children. My topic really is impact on children, not populations, but I just wanted to make sure that you understand why we're going to be doing what we do. And as a child psychiatrist, I really like color, I like pictures, I like being able to maybe be a little bit childlike. I was going to wear a sweatshirt, and I thought, well, maybe not today. This is what I have on my agenda. I have a short video, which UNICEF was kindly given me permission to use. And then I want to talk about the children of the world, children of color, kind of where are they? And then children and families and various disasters, the psychological impacts, a community response, and then our children and our future. I wanted to start just picking up from yesterday about global temperatures. And if you noticed, at least in the United States, we've started taking temperatures of the globe early in 1880. And so all the blue are the cold parts, and then all the red is certainly the hotter temperatures. This goes till 2020, but actually this last summer, and I'm sure all of you also experienced it, we had some of the hottest days ever. And in Death Valley, it was 127. So you can imagine how difficult that was for other people, particularly where people don't have air conditioning, and there's significantly more deaths related to them among the elderly. So this was a very difficult time. Now, the children of the world, where are they? Well, I must say I learned a lot in just looking up this material. If you notice the darker areas in Africa, this is where 40 to 50% of all the children are located, in Africa and Asia. And then you see the green, that's only 10%. And you see that, China has an older population, probably had a lot to do with the fact that they've changed their allowance in terms of people being able to have children. But this is the area that I focused on with respect to Africa, the continent. And I wanted to also mention the indigenous populations, because that doesn't get much play in our country. But I think it's important to remember this is 476 million people who identify themselves as indigenous. And in our country now, with the census, you can kind of put yourself in whatever category you feel is appropriate. But it's 5% of the population of the world, 90 countries over every continent, 5,000 different peoples and 4,000 different languages, 70% living in the Asia. I'll mention that Africa, though, has 3,000 groups, 2,000 languages or dialects, and Kenya was listed as the largest indigenous population, representing 25% of the population. Now, the important factors, though, are 50% of the world's poverty are in this group. So we're talking, there are people without land, there are people who often suffer because of food scarcity, and there's internal displacement among this group. There is migration. And I think it's sometimes forced migration. It's not the migration that we heard about yesterday so much in terms of people wanting to do that on their own. Now, how old are they? I was really looking at people, children under 15. 40% of Africans' population is in this range. Now, although India and the US and China are mentioned here, their populations are very different. We have over a billion people in India, a billion people in China. The United States has 300 million. But by 2050, Nigeria's population is projected to exceed that of the United States. I wanted to talk a little bit about health, because climate change and children's health are dependent on these kinds of factors, poverty, and there's significant poverty in the world and significant poverty in the United States. Maternal health relates to the issue of poverty. prenatal care, whether you're able to have access to care, whether that will then give you a healthy baby. Often there's prematurity, organ underdevelopment, and particularly lungs and asthma, and food scarcity. And we are now having not only climate change, but we're really coming out of having this significant COVID problem. And in our country, as the world, food scarcity is critical. And extreme heat also is a major factor in terms of the environment in which pollutants are available and cause harm as well to infants. Now, the infant mortality in the United States is significant, first of all, because almost 20,000 infants in the United States will die in 2020, and the dates, the years follow, so we don't know what the figures will be for this year. But the leading causes of death, and I'll just mention those two related to preterm birth and birth weight and maternal pregnancy complications, are certainly related to poverty, and when you add that to other difficulties related to, which we're going to talk about, related to climate change, you'll see that it's an escalating effect. Now, I stuck this slide from it's a CDC slide, but from the New York Times, because for the first time ever, we've noticed that there's been an increase in deaths of not only white infants, but also black infants as well as white infants. And that's new, because in the past, it's always been the black children who've had the significant death rate. And I would say also black mothers, and that's an important factor, because not only black mothers who are in poverty and have low income, but black mothers who have maybe college degrees. Recently, we had a black mother who was a physician in Illinois who died, as well as the infant. And the issue really has to do, we're not really sure, because she had prenatal care, but this is a major factor that we're also looking at and needs more research. This is an area that hasn't had much research. So when you look at black infant deaths, and you look across the South, the Mississippi, Louisiana, Alabama, Georgia, this is where most of the significant black deaths are. Mississippi, over 40%. So this is a critical factor in our country. If you want to have a healthy baby, you go to places like Massachusetts and California. Now, what do the world figures look like? This is World Health, WHO data, and I hope you can see that. Oh, you can. I can see that slide. These are the top 20 countries and their mortality figures for infants, and you'll see that of those 20, a significant number are really countries with color population, high color populations, and then the sub-Saharan Africa has the highest mortality rate in the world, followed by Central and Southeastern Asia. Now, the mental health. Those of you who are familiar with ACEs know that this pyramid, the largest base starts at conception and it goes up to death. And then we know that events that are traumatic in the lives of families and children have a multiplying effect going up to actually causing people to think of healthy, not so healthy activities like drinking, smoking, substance abuse, et cetera. And the more of these that you have, the more likelihood you are to suffer disease and breakdown. And these arrows on the right really refer to the need for more research. This is an area that we could learn more about. And when I was looking up the literature about, what is there already about children of color, there's not a lot. It's mainly a population that we've really been neglected in many ways, and not just in child work, but also in adult work, and David will tell you the same. Before recently, I would say maybe the last couple of years, there has not been interest in our federal government, the NIH and NIMH, to do work on Black populations. And now there is a change. We had a lecture by the director of NIMH recently who said that he was embarrassed by the fact that when people were asking about, well, what's the effect of this particular drug on Black people, they didn't really know because they hadn't really included them in the research studies. And he said that, and in fact, if you look on the website, he said that this was going to change. Not only was he going to increase the number of investigators, particularly young investigators, who might be interested in research in this population, but as it was going to be a mandate that you had to have a Black population, you had to be relevant. And I think more people are really understanding that it's not relevant if you've only done your work on white individuals. It's important for you to also include other groups, even though you may not have done it in the past. So this is a change, and I think this is going to be very important for our country. One of the things I wanted to say that is the last, which is as you get to the top of that pyramid, the 5 of the 10 leading causes of death are associated with a greater number of these events that you've had in your life. And of course, yesterday we talked about witnessing violence, experiencing violence, food scarcity, displacement. All of these relate also to climate change. So you have the adverse events, and then you add to that climate change, and you're talking, we're moving closer and closer to that pyramid, which we don't want to have. Now, there's a lovely book by Compton and Ruth Shem called The Social Determinants of Mental Health. And you'll notice there is a kind of an overlap in this group. Here again, we're talking about poverty, economic disparities, talking about maternal health, food scarcity, environmental difficulties. In our country, we have what you call redlining, which means that there are certain areas that you're going to be restricted in terms of being able, it doesn't matter what your money is, but restricted in terms of your ability to move into those particular areas. So even if you're middle class, you may still not be able to have the kind of home that you would like to have in the area that you would like to have. So you'll find that many individuals who are poor are restricted to low-lying areas, areas that may flood, areas that may be where before they built homes, there were dumps for polluting materials. So this becomes a major issue in terms of structural housing in our country. And then poor access. I think one of our speakers yesterday talked about equitable health care and having access to it. And unfortunately, most of the health care in our country is based on your being able to have a job. If you don't have a job, then your employer doesn't pay into the fund, therefore you don't have access. Now, there are certain areas, certain states that do have the Medicaid expansion, and that was allowed, it was offered to a number of states, and I would tell you that those groups that have the highest maternal and child mortality, many of them did not want to do that because even though the federal government was going to give them money, the money back, they did not do that. So it's understandable why those states have significant mortality rates among Black people. And then educational resources. Here again, we're talking about the importance of being able to access education. In the past, we've always thought as Black people that education gave you a way out. But if that's interrupted, then it's very difficult in our country to be able to be mobile and to move up. And that's a critical factor. And with the climate change and the disruptions that we will talk about, and the COVID problem, we've had significant delays in our schooling system because of COVID. If you lived in some of the suburbs of Massachusetts, the community schools, and the schools are supported by tax money, the community schools provided individual computers for those individuals who were in the more affluent areas. But if you were in the poorer areas, you didn't have access, and therefore most of the education was, and I should look this way too, sorry. Most of the education was by computer and not by a personal teacher. So that will become a major problem, and we've seen that individuals, as they've done some of the testing now, they see that there's significant lag in the United States in terms of the educational attainment that children were able to make. But it's interesting, I just saw some data recently that the Defense Department, I didn't even know they had their own personal schools for children, but evidently of their particular families, those schools kept going even during COVID. So they did not lose space and attainment of skills. So that was also important too. Now, socialization and culture. One of the important areas in terms of children has to do with being able to meet your peers, learn how to play. That's one of the first skills that we really are looking at in terms of child psychiatry. We do a lot of play therapy, and there's a reason why we do that, because we're trying to help children understand the socialization that's necessary for them to be successful in life. With the change in the schools and the shutdown of the schools and the closing of the community centers, even the basketball centers, the YWCA, the Girl Scouts, the Boy Scouts, all these socialization activities were at a shutdown during COVID. And when there are major disasters in communities, these also shut down, and that becomes a socialization issue. Loneliness, our current Surgeon General has written a book about loneliness. His focus has been mainly on adults, but loneliness is a critical issue for children as well. You'll see depression, you'll see anxiety, you'll see sadness. So these are all compacted together, and then we have the various pandemics, we have the various disasters. They just escalate the effects. And then I added racism, and that's also a social determinant in Shim's book. And this is also an issue that's only recently gotten much attention. I don't know if you've heard of Al Poussaint, for example. He's one of the colleagues who writes in the public press, lay press. He's been trying to get the APA to think about racism as an important factor diagnostically in terms of thinking about the impact of this on individuals' mental health. But I think it is a social determinant. We all understand that, and the well-being of children. It's unfortunate that one has to begin to really teach about racism almost from the cradle, really, because children understand, they may not understand speech, but they do understand how you look at them, how you treat them, how you smile at them or not. These are nonverbal cues that children are very aware of, and when you don't look at someone because you're not angry, they learn certain faces, what's anger, what's happiness, what's sadness. There's not really a face for racism, in terms of the charts that demonstrate different skill levels in terms of helping children understand how people are feeling or how they're feeling. But it's something that you recognize very clearly, and as you get older, it becomes even more of a concern. And it's a driver of not only social problems, but of mental health problems. One of the issues that often comes up in treating people is, I don't understand why people don't like me. I don't understand why they looked at me that way, or I don't understand why they question. I even had some physicians say, I don't understand why they question my orders. I'm a physician, I'm licensed. These are older people, but I'm saying that racism is through the spectrum of life in general. Now, I'm going to talk just a little bit about hurricanes, and This is a picture actually from Liberia, and it has to do with a woman who's putting barricades up to protect her home against floods. This is something that you see all over the world as you see the rising sea levels. This is a slide that I like to use because Hurricane Katrina was one of the deadliest hurricanes in the United States had ever experienced in 2005. And what made it so really tragic was that although there is awareness that storms are coming, because you live in low-lying areas, and I don't know how your traffic is here, but it's hard to escape. It's hard to go north. It's hard to get away from the low level of your geography just because you know there's a storm coming. But I think no one really predicted that there were going to be over 1,800 deaths. Many of them were children, drownings. They were just tragedies. There were hospitals that were closed. And there were other hospitals that wanted to stay open and couldn't, and they were trying to use helicopters to ferry people out of the deadly storms. And I remember one story that one of the researchers who went down there almost immediately to look at this indicated that they had the mother in one of those buckets that you carry helicopters over from one building to the other. And she had just delivered a newborn, and she dropped the newborn into the water. So it was, you can imagine the post-traumatic stress that is an experience not only for this mother, but it's an experience for all of the children who, in the family, the other family members. It's a major tragedy. And there were just many tragedies like this. Separation, in terms of once this happened, people, FEMA and other people would come into the area, and they sent people to desperate areas of the country. For example, as a black person, you might be sent to an area in North Dakota. Very few black people in North Dakota, Idaho. Or you might even go to California. Well, it's one thing to go to California, but if you have parents that live or that lived in Louisiana, and then you're splitting them up, even if they were divorced, it's a major trauma for children. Kronberg, now that Hurricane Katrina started in 2000, or happened in 2005, Kronberg was a researcher, did a study of children 5 years later. And the issue of, these are the diagnostic areas that you'll see that you're not surprised about. The anxiety, the depression, post-traumatic stress, all of these are destabilizing effects, and significantly greater for females. Now, why is that? Well, this is the research currently ongoing, but the fact is that females are often the caregivers. They take care of the children, they manage the family. So it's not, untoward to think that females would be the ones who would suffer. And then, of course, we know that if the family is held together in a more positive sense, in terms of people being able to manage all these stressors, then everyone in the family does better. Continuing this, now, this speaks to the fact that entire communities were impacted. So it's not just that, an area of the country was a problem, but, even if you lived in Louisiana or Alabama or wherever the storm hit, you have relatives throughout the country. And so everyone felt the loss. There were 300,000 children, can you imagine, 300,000 children who did not go to school. And many of them were transported, even though Louisiana is close to Texas, it's not that close. Particularly related to cultural issues. There's a very different, from one culture to the other, going from Texas to Louisiana, going to North Dakota, going to Michigan. So this is a major problem in terms of not only families feeling themselves, getting their footing. I don't know how many times you all have moved, but if you have to pack up your clothes, even if you know you're going to move, it's very disorienting in terms of, kind of, you've got to find physicians, you've got to find school, you've got to find a place that you feel safe and so forth. So it's not unreasonable to suspect that children experienced learning disorders. They didn't want to go to school. They had emotional dysregulation. They were aggressive. They became problems before they may not have had problems. Sleep disturbance, increased fears, worries. Now, I looked in, trying to look in, the Harvard Library has supposedly access to everything. There's not a whole lot, and I think that speaks to research about what else is happening in the rest of the world. It's mainly European, United States, some Canadian, some South America, or in some countries where they don't have English translation. And so, but this is one paper that I thought was very useful. And they talked about, and these were African researchers, and they talked about the impact of coastal communities and the flooding and this soil erosion and the resistance of some of the women heads of household to actually move, even when they knew there was a risk to their having to move their families, because they already had personal businesses in the area, and they resisted wanting to leave those businesses. And so, but what you also saw was a feminization of poverty. So you see more and more women who now are at risk for poverty. This is an issue we see in the States as well. And in fact, we coined a term, the feminization of poverty, particularly in the court system, because poverty related to, the fact that, particularly in divorce and custody issues, which have been my business. But when you see that this happens and then women are left with very little support, they then may even sink from a middle class to a lower class in terms of the economic status that they are used to. This is actually coastal flooding here in South Africa, and I know that you've had difficulty with respect to water shortages and coastal damage, et cetera. And this is a global phenomenon, not just in the United States and Hurricane Katrina. Now, to shift gears, this is a NASA picture on the left of the sun, but these are fires. This particular fire is in Pakistan, but these are fires that have been all over the world. We know that wildfires, and I think we heard one of our speakers yesterday talk about wildfires and droughts, and often you see them kind of come together and affect the air quality not only in the Amazon, but affect the air quality and pollution throughout the world. And this is a picture of New York City. This is this summer in June. We were experiencing the wildfires from Canada. Canada did more damage to their footprint in terms of the way in which they've emitted, problems, pollution in the air in that period of time than they had in the previous couple of years. So it was a significant concern. And then the picture on the right is the way this, out the same window, usually looked. And this carried on for days. So there was certainly, in New York is also a place where Black children don't do well in terms of asthma. And so you can imagine they were asking the children to wear masks and to stay indoors, not go to school. So this was also a critical concern for New York City. And the ash from the Canadian forest also were found over in Spain. So they come across and into other areas of the world. Now, here is a NASA satellite photo, and I wanted you to see that because if you notice, Africa is right there in the middle, and you see how much burning there is there. You can barely see the fires in Canada, which are, right above the United States. You do see the Brazil fires. So even though I showed you the pictures of the pollution in the slide before, and you could see the difference between the air and the polluted air and the clean air, you know that by the size of the fires in Africa, how much more pollution is there than we were experiencing in New York City. Floods and droughts. This really is another area in which sometimes you'll see them come together. We just had a major drought in California, and then climate change had big storms in the mountains, large snow, then they had overabundance of rain, et cetera. Water scarcity, flooding, all of these migration are typical. People going to the cities, crowding the cities, causing more difficulties in terms of reduced air quality and overcrowding of refugees. Now, in the United States, we have significant refugees coming. Some are legal, some are not legal, but they're also fleeing Central America, South America, coming in from other countries of the world because of the changes that they're experiencing. They're not able to manage to stay in their own home communities. So this is a concern for the world. Now, this is a prototype back to the United States. Flint, Michigan is a little town which was a mixed town of whites and blacks. And in 2014, they noticed that there were many children coming in with the diagnosis of attention deficit disorder. And they began to do some studies, and they found lead. And the lead, they actually factored back and found that it was coming out of the water. Now, not only do we have an older infrastructure in terms of the pipes that carry the water, but there's also pollution, dangerous levels of pollution that are industrial waste and things like that. You'll find that many of I talked before about poverty often means that you have to make your living in an industrial waste area where other people, if they had positive cash flow, they would not have to do that. And then what happened was everyone got excited about this lead and these poor children. What are we going to do about it? Well, what they did was to bring in bottled water. Well, that'll only last so long. I mean, you can only do that so long. I mean, in terms of washing, in terms of taking baths, drinking water, et cetera. And what gradually happened was, one, there was a court case filed against the government officials. That was the other thing I was noticing. Everything in our country is political. I don't know about your country, but in my country, everything is political. So it doesn't matter, particularly related to healthcare. And so a suit was filed against the governor and other people higher up. And especially after the Civil Rights Commission concluded that there was poor government response that was a result of systemic racism. I mean, that you'd almost never see something like that. I mean, that's just unheard of. So you wonder, well, what happened? Well, what happened was white people who could left, leaving a significant 100,000 people. They're all black. They're all black. In this area, the water is not changed. Before I came down here, I saw that the judge had rendered a decision that actually exonerated the governor. So no one has been held responsible for this, and the water problem continues. Now, again, Walensky has done a very interesting systematic study of literature review, excuse me. Of storms and floods and migration and fires, and this is all over the world. I think they looked at over 1,000 works, and so you might be interested. It's from 2023, and looking at that. And what they did see was increased diagnosis of mental disorders, psychological distress, and increase, and I think we had a talk yesterday about emergency admissions. that was also a finding that they were able to see in the general literature. And then trauma, the impact on mental health. Heat, weather events, whether it's heat, whether it's, well, we don't have much cold weather, but heat is a major problem that we're now experiencing, persistent stressors related to migration, et cetera. I think one of the interesting things about the Alaskan indigenous people is that for whatever reason, they have had some massive snowstorms recently, and we're not prepared to take care of individuals who are homeless. And that is a major population in the country, in our country. And when you have homeless families, and I mean children who are also homeless, so they're on the street, they're begging in cold. The way the shelter system works in many places is that there are only a certain number of beds per night. So let's say there are 1,000 beds, but once the 1,000 is reached, then you're in a real pickle. Even in Massachusetts, what they've now done, because that's one of the areas that still may get cold in the winter, they have put aside money for hotels. So you can go into a hotel. Although, right before I got on the plane, I did see that the State House is revisiting the whole idea of the amount of money that we are expending on hotels for homeless people and children and families because it is so expensive. So you see, this becomes a real cycle. You lose your job. You lose your perhaps for whatever reason, you're migrating up to a place that has a little higher social support. Massachusetts is probably better than being in Mississippi. And so then you get there, or better than even being in Florida. We've had the governor send migrants, workers, up to Martha's Vineyard, which is, it's kind of the island that the Kennedys would vacation on, and actually President Obama vacations on. Send them up there. The island is not a place where you really want to live year-round anyway, but to send people where they have no place to go and their children, and you just give them a one-way ticket, it's a disaster that is bound to be a problem in terms of everybody's ability to manage the stress. So we see that this has impact on the mental health system. And even in Massachusetts, we have David is there, he has BU, there's Harvard, there's Tufts, there's UMass, there are lots of places, but one of the problems we persistently have has to do with boarding of children in the emergency rooms. And I don't know if you understand exactly what I'm saying, which is that if there are no beds and you have a psychiatric illness, you may stay in the emergency room for days, waiting on a place. Where can you go? And that becomes a stressor for families as well. I talked a little bit about displacement. This is one of the slides I was able to get related to actually displacement in sub-Saharan Africa. Women and girls were disproportionately affected, and there's some evidence that there is intergenerational transmission. If your parents experience a trauma, that can certainly be passed down to children. And I talked with you before about the stability of the family often rests with the mothers, and if they're doing well, it can be a positive factor in terms of children doing well. Now, I mentioned racism. This is a bulletin that just came out in maybe the spring of this year, and it's from our Homeland Security. And it talked about violent extremist attacks. Now, this is really an issue of racism. As you probably have read about how much Black people have been the victims of various tragedies, whether it's going to the grocery store and there are 12 people killed, or going to a church. But these are things that are on top of the events I talked about, like Katrina and like the other various storms. We've had major storms just since January of this year that have meant that people had to be displaced. So not only do you have that, but then you have this to also worry about as a family member. And then these are, it's almost like a contagious event, because all Black parents notice this and become concerned about their children. And when you see the events in Texas, in which the whole school was under attack and so many children were killed, and you know, Mexican children, or if you're in Connecticut, they're white children. And so as a Black parent, you say, my goodness, you know, what is my chances that my child also is not going to be safe in terms of going to school? And this engenders anxiety. You could say, well, is this climate related? Well, it is. Some of it is, not all of it is. Some of it is just racism in general. But there are studies to show that increasing the temperatures does increase the violence that one sees, whether it's domestic violence or whether it's increased violence on the streets. Unfortunately, our country is full of AK-47 rifles and guns. Almost everybody has a gun. I don't have a gun, but almost everybody has a gun. But you worry about it. You say, oh my goodness, what am I going to do if somebody comes in? And you know, I would also say, as an aside, which is not particularly related to climate change, but it has to do with many of our police forces are down in terms of the numbers to protect the population. So if you're an African-American family and you're calling for aid, the chances of your getting an emergency response may not be, depending on your community, may not be as rapid as you need. This is another picture about, this particular is Trinidad. It's about children, racism, and violence. And this says, we are one bullet away from becoming a hashtag. And so this is, you know, they're not only worried about their personal safety, but then when there are other things that happen in their country that affect their residents, their safety, their homes, their families, this in addition to that. Now, I just picked up this picture actually from East Africa, which talked about disputes over water rights. And I think one of the lecturers yesterday was talking about the fact that individuals, communities believe that they have a right to water and land, and this is not unusual. One of the problems in Alaska with the indigenous individuals there has to do with the fact that there's such a change in their ability to carry on cultural norms, such that there's more increased suicidal ideation and completed suicide among younger indigenous populations in this northern part of our Alaskan regions. And they're not able to do the same culture that they were used to. Canadian indigenous populations have also seen this. And then some of the researchers talk about resilience. And of course, if you have all the pluses going for your family and their ability to manage, you're going to do better. There's no question about that. If you have financial support, you're going to do even more better with this. And then the framework, though, to think about how children are experiencing the world around them has to do with understanding development. And so having a good sense of what the development of a normal child would do in terms of progress, and then understand that how your child that you may be looking at in terms of a patient population, how they're experiencing it as well. And then there's certainly a lot of work on resilience and recovery. And the more events you have in your life that are traumatic, the more difficult it's going to be in terms of being able to recover. Now, I want to talk just briefly about restorative efforts. This is a book that Anil Prem and I co-edited, and it's interesting, as I was thinking about it, it was Chester Pierce's idea to celebrate Solomon Carter Fuller. Solomon Carter Fuller was the first African-American psychiatrist in the United States. And when Chester and his colleagues confronted the American Psychiatric Association, and this is 1969, about the various issues of racism. Now, you know, 69, we're just experiencing all the assassinations, Martin Luther King and Kennedy, and there was a lot of discontent about the war. And you have all these veterans coming back, and they were treated like lepers, and many of them were black, because at that time we had a draft, and certainly it would be hard for you as a black person to avoid the draft. So many of the people who were dead were black people, and that meant impacting their families, and then many of the people then coming into this anti-war movement. And I would say Chester was one of those. He told me, just a personal story, he told me that he'd been, and I'm not surprised, he'd been part of the March on Washington with Dr. King. And somebody was talking about gossip the other day. I mean, this is just an aside. I don't know why we were meeting, but he said, and I was up there with all those movie stars, trying to think, Paul Newman and Belafonte, and he was just dropping all these names, and I said, my goodness, what were you doing there? So he was saying that we all then went out to dinner together, and I said, oh man, that's fabulous, it's exciting. And he said, yeah, and he said this one, Paul Newman got up and he said, let me make the dressing for the salad. And he said, everybody looked at him, you're going to make the dressing? And that became Paul Newman dressing, which is big in the United States. So, Chet he was so happy to tell me that story. But anyway, so going back to this, this fellowship or award, the Solomon Carter Fuller Award, actually came because Chet and a group of the black psychiatrists confronted, and I wasn't there, but I understand it was a very heated confrontation of the American Psychiatric Association Board of Trustees, saying, we've got to have change. We've got to have black people, women, and that was the other thing Chester said, we have to bring other people along with us. We can't just do it for black people. We've got to have all the different minority groups and underrepresented groups to be a part of the association, because right now it's all white. And at that time, if you look back in the literature of the 60s, there was still segregation in the various hospitals in terms of beds, et cetera, et cetera. But he said, we've got to have this. And actually, he was one of the first Solomon Carter Fuller addresses. Now, fast forward, I'm looking for the addresses. I'm looking for in the various archives of the APA, trying to find out, well, where is his address? Where are these other people? I mean, there were really amazing people who had been Solomon Carter Fuller awardees. There's no record. And I said, well, this can't be. And actually, we were able to get support from the APA to have this book. But they said you can't just publish the lecture. You've got to make it updated. So that's how we came up with Mental Health Racism and Contemporary Challenges of Being Black in America. And thank you, Michelle. Michelle did a part of the book as well. So these three people, Phyllis Harrison Ross, Lucille, who was one of the first leaders in the Black Psychiatrists of America, Lucille Norville Perez, who was the president at that time of the National Medical Association, which is certainly the organization that is kind of for Black physicians and anyone. But in the past, you couldn't belong to the American Medical Association. If you wanted privileges in a hospital, if you weren't a member of the American Medical Association, you could not get privileges. So Black physicians formed their own organization, and she was the president at the time. And Annelle Prim, who was the associate medical director of the American Psychiatric Association, the three of them got together and said, we need to be able to do something for Black people who are experiencing these tragedies related to Hurricane Katrina. And the problem was that people who were victims felt that there was a difference in the way the federal government handled their cases versus everyone else's. They didn't get the response in a quick manner. They didn't get the funds. They didn't get the ability to save their homes. And of course, you know, if homes have been flooded, they soon become moldy, and then you have to just tear them down. So that became an issue in which they formed an interdisciplinary team of ministers, social workers, psychologists, lay communities, civic leaders, historically Black college individuals, and nonprofits. And they formed this group. This is a group that meets still, in Hurricane Katrina was 2005. They meet every Sunday night on a telephone call. And they provide support and in terms of their being able to helping the communities to manage whatever the stresses are. And since that, of course, there have been major stressors related to the hurricanes in Florida and North Carolina and Louisiana. And Nell was just in Mississippi 2 weeks ago related to storms and FEMA interest in that community. And then of racism. They felt that they were not adequately addressing the concerns that their communities faced. So this is a group that has continued. Now, the best practices. These are areas that they felt were very important for the community. One has to do with providing a presence, a ministry of presence, meaning we haven't forgotten you. We know that you're important to us. You're not ignored. We are there to support you. And many of the persons who actually were providing the support had also been victims of the various storms. And then the issue of heroes of healing. They've identified individuals who've kind of gone beyond and above whatever the difficulties have been in the community and created major stories that have been helpful in healing, and stories can be healing. And then in the process of this, although it started as related to Hurricane Katrina, we've now had another tragedy in Buffalo, New York, in which they were called in to help in that community as well. And that's been a very important and resilient building support for the community. And emancipation circles. This is where they've just gone over the background of violence and disasters that have occurred and found a way to be using healing and able to mix their concerns about supporting each other. And one of the important things that happened there was that the Commissioner of Mental Health felt that this was such an important factor, even though they were not based in Buffalo, that they gave them a grant to actually provide services to support that community. Well, I had a picture there. The reason I put this down was because Claudia Goldin, actually a professor at Harvard, just won the Nobel Prize for Economics this year. But her study was about women and how important they are in terms of the fact that they've been neglected because of the gender wage gap, about the services in which they provided to families. And I thought this was relevant because of the way in which women are ignored everywhere, about how important they are in terms of keeping families together, and particularly in disasters. And this is a picture of the Nobel Prize winner, actually, here in Africa, from Kenya, who got her Peace Prize related to social environment. And I thought this was a major, I mean, if you probably knew her story better than I, but major environmentalists to win this award. And then that brings us back to Chester. I'll just stop for a moment because clearly Chester has been a mentor for all of you, whether you knew him or not, in terms of just your presence here. You can Google, if you haven't already read, his book on, or his paper. It was an educational conference for the United States Department of Education on extreme environments, the ghetto, and the South Pole. And I would say that I've read it several times, and every time I read it, I pick up something different because it is really so significant and in depth. This paper was written in 1981, so he was already projecting what the experience of living extreme environments would be like for a little 9-year-old boy. And I think he was really talking about comparing that to the space and the polar regions that he was doing research on, but he was also talking about the experience of racism and the experience of climate, and understanding how important it was for children to be prepared for a future that was unknown but projected to be one filled with challenges. And you know, the things that you remember about him, certainly, I mean, he was always talking about Mars, and I was thinking, Mars, I can't get through the next lecture here of whatever it is I was doing in my residency. But he had that kind of enthusiasm and challenging thought about how important it was for all of us to be prepared to take on the next challenge. And he also thought it was important that we understood this as something in which you pass the baton to and I was really happy to see how many young people you have involved in your program here, but that you would pass the baton on to them, because he started this challenge way before '69 to the American Psychiatric Association and to the rest of the world. But then he continued and has always been someone who's challenged you to do your best, to go beyond, to go beyond what you think you know, to even extend that. And so, and if you recall, he was particularly interested in children. Sesame Street was one of his brainstorms, and that he was involved in that. And the Electric Company in the United States, those were really premier children's shows that were interested in integrating their cast so that when black children would see the television, they could identify themselves in that mechanism. But one of the things that I thought was so important was these two quotes. One is that hope is the last refuge for those wretched who are in the throes of an extremely stressful environment. And he really saw that, you know, the racism is as extreme as being in the polar caps. And then hopelessness, the ultimate danger that embraces one's present plight as well as the projected future. So if you're hopeless and you can't do anything about what's to happen in the future, that's a failure for all of us. So I thought those were important, and you'll see that in that paper that I suggested that you, if you haven't already read, that you would look at it. Now, one of the hopeful aspects of looking at all of this climate change that we're experiencing has to do with youth. And I must say that, they're challenging us, but they're challenging through the court systems about that they have a right to clean water. And just as we saw in the videotape, that they have a right to being able to breathe good air. They shouldn't have to worry about that. And so most recently in the United States, some children actually brought a case in Montana and they won. Now, we'll see if, because we have a Supreme Court that's not always been friendly to Black issues, but, we'll see. They won the first part. And then this is an interesting young woman from Baltimore who was considered Time's next generation leader. And she also won the 2016 Goldman Environmental Prize, and this had to do with recycling in Baltimore, and she became a leader as a teenager and has continued that. Now, looking at climate change, I get the New York Times, and they had a conference, and I was thinking to myself, well, wonder what they're going to say about children of color. Well, they didn't say much. In fact, they said very little. But there did have some interesting Black people involved, and one was Mia Mottley, who's the Prime Minister of Barbados, and she's become a major figure in the nations, in the UN, related to climate change and environment, and challenging those larger countries about what they're doing. And in fact, she called them all hypocrites. And I thought, wow. And this is on an international program, because she said, we need help with environmental challenges, and then you're charging us the same interest rates that everyone else pays, and that's not right. So I thought that was critical. And then I put Al Gore. He was there because he talked about the moral hazard that we're facing with places like the United States and China continuing to pollute and use fossil fuels and have very little. They pay lip service, but they're not doing enough from his point of view. And then I thought it was interesting to have the president of Kenya there in this group of distinguished guests, and his view of the importance of going green in Kenya and his goal for that. But, like everything else, and I like little stories, someone in the press said, well, we saw that you had a lot of demonstrations. Everybody's not on board with what you're doing. And he said, this is a democracy. I'm happy with demonstrations. And then, so they weren't happy with that comment, and they said, well, why are you going, because I think the next big conference is going to be in one of the fossil fuel countries. It's not Saudi Arabia, but it's one of the others. And he said, but it's important to get people at least engaged in thinking that they have, whether it's guilt money or whatever, that they have a responsibility to think about how the rest of the world is faring. So I thought that was worthwhile. This is David Satcher, and you're probably familiar. He's the 16th Surgeon General in the United States, but he's also founded a leadership institute, and he's been a director of the Centers for Disease Control and Prevention in the United States. And he's also one of our contributors in the book. But the reason I have him here is because he talks about leadership. And leadership responds to opportunities, challenges, and crises. We're all facing this challenge and crisis with global climate change. You're all here, you're all leaders. You don't know what your leadership is going to lead you to in the next 5 years, but you know that you're here now, you're listening, you're making alliances and relationships with people, and that's so important in leadership development. Leadership is not a position. You don't have to be the number one person to be a leader. You can be anyone. It's a team sport. We all have a role. I think these are critical things to think about. It transforms communities, and that's what we're about here, is how to transform our community. And it recognizes and requires a global perspective. Before, our country had been really isolative periodically, depending on who the leadership has been. But to think globally, and even, Chester, even in all of his life, has really seen himself as a global person and not defined by the parameters of the United States. So I think that is particularly relevant. And leadership is a relay race. All of us have a little role to play along the way. Chester started, in terms of thinking about how we can all be leaders in 1969 in a particularly restricted conservative organization, but he also knew that it was important to pass the baton along the way, that maybe you wouldn't see everything in your lifespan, but there are still roles for you to play, and I think that relay race is a positive. And then my summary points are that climate change is real. It impacts the mental health of children and families globally. Children of color suffer disproportionately from climate change. The social determinants of mental health, including racism, are key factors in the disparate impact of climate change on children of color. And taking action and being an agent of change have positive mental health effects for both the individuals who are doing the work as well as children who see that something can be done. You don't have to be a passive victim of what's happening in your world around you. And then this reminds me of our video that we started with, which you have children of the world who are really challenging us to be more responsive, responsible. They want to see green trees, they want to see flowers, they want to see animals, and they want to see water, clean water. And this is the importance of our continuing to be active in this field and not get frustrated by whatever the challenges are. Thank you so much.
Thank you. We probably have time for one question if anyone has a thought, comment, question. Yes. Where's the
Okay, there we go. Thank you so much, Donna, for the fantastic presentation. I think because there is room for only one question, I am going to take the opportunity. It's not a question, it's a response to the presentation. So it's a mix of a comment and a question, but just listening to you and the All Healers Mental Health Alliance, that really stood out for me in terms of a group of people organizing and positioning to respond, interdisciplinary group of people organizing and preparing to respond to disasters. It'll be interesting to know what, can I call them armor, we're doing during COVID-19, and how do they stay active during, in between disasters, and more importantly, if there is room or scope for sharing the knowledge that AMA has developed over years across the borders into Africa, especially in the context of pandemic prevention, preparedness, which is a strong focus on the continent right now, and how mental health actually cuts across in terms of preparing for disasters. Thank you.
Okay, thank you for your comment. In terms of how do they stay active, as I mentioned, they meet weekly. Every Sunday night, people know that, if you can't make every Sunday, somebody's going to be on the call because there are always things happening. Now they've expanded, it's not just whether it's hurricanes or storms, it also has to do with violent events that may happen in the Black community. Periodically, they've had conferences. They've gotten outside money because these are individuals all over the country. So they're as far away from California, North Carolina, Florida to Michigan. And so they've had conferences in which they document what their work is and how to support each other, really. This is free. This is all free volunteer services. So that becomes an important factor. Now, most recently, we had major fires in Hawaii. It's interesting that FEMA has contacted this group because they represent people of color. And actually, the people in Hawaii did not want to see the usual people who would come to these meetings, come to their assistance. And they knew this group, and they asked, can you bring us some people from that group to be of help to us? So even though they didn't start to be a universal group, and they're not paid, they still have their own jobs, but they have allowed themselves to be tapped by the federal agencies to do work where it's necessary, because otherwise they don't have anything. Okay.
Thank you.
Thank you.
Thanks so much, Donna.